Hi, my name is Julia Gonzalez, and I'm here to talk about the World Health Organization Healthcare Administration. So a little bit about the World Health Organization. It relates strongly back to the United Nations. Back in 1945, when the United Nations started to pretty much come together, they talked about how important it was for there to be some type of major healthcare and provisions throughout pretty much all of the world. A little bit later on, in 1945, after some deliberation, April 7th came around, and that's when the World Health Organization signed their first constitution to say that they are going to create leadership and these provisions to ensure that every country that is a part of their organization is going to get the same amount of health care. There are 194 countries that are present in the World Healthcare Organization, which is a majority of the countries. However, there are some countries that are kind of left out as well. So the United States is one of the countries that is a part of the World Healthcare Organization, and it's mostly private sectors that take over the healthcare system. Most of those healthcares are given by employers. People are also able to purchase them privately. However, there are some people who are left uninsured. Back in 2013, there were 45,000 deaths that related back to people who were uninsured. And what I did was later connect it to the Universal Declaration of Human Rights, Article 25 in Section 1, where it had said that everyone has the right to standard and adequate health care, along with food, water, housing, and everything like that. So this made me think that those 45,000 people in the United States did not get that average human right. Nobody had been given the chance to get that adequate healthcare system. I had found an article a little bit later on by Elizabeth Tobin Tyler, who writes journal entries relating how the United States is making strides, and she had written one about Affordable Health Care Acts. And she had said that affordable health care is based on the fact that people are just solely human. Everyone should be able to get the same type of health care just because they do have a beating heart and just because they do have a personality and a brain, and nobody should be deprived of that right. In relating this to South Africa, like a couple of my previous classmates had talked about, they had said that the healthcare in South Africa is divided into that private and public sector. About 80% of the South African population will use that public healthcare system, and this has been seen as not very accessible and doesn't give the proper amount of treatment that people deserve. Hospitals before the first democratic election back in 1994 had been racially segregated, which made me think a lot about the 1960s when the United States had been segregated and how whites and blacks were separated and they really couldn't even go to the same school. So I had based this off the concept that the world is essentially changing and they all have the same ideas, but they all happen at such different times that's where people are being affected. People are not getting to the point at the same page, and it's starting to become difficult for everyone to constantly understand why things are starting to become more difficult. South Africa is starting these provisions to change their healthcare system and make it so that their public healthcare is going to be more easily accessible to minimize the rates of HIV, the amount of tuberculosis cases, as well as the amount of maternal deaths, which is actually very prevalent in South Africa. There's about 310 deaths per 10,000 lives for either maternal cases or child cases, so either at childbirth or due to infection right after childbirth. And this made me connect directly to Half the Sky, which we had read in class, just because it's constantly talking about women's oppressions and as well as girl oppressions. So because of those treatments that are not necessarily given to children or to the women, that just pretty much shows me that our healthcare systems do need some type of revelation as well as the rest of the world. So as a biomedical science major, I'm very interested in the healthcare systems. I eventually do want to go to law school to start talking about healthcare law and work for hospitals and all of their malpractice cases, because I do believe that healthcare is something that everyone wants. It's just not easily obtainable. So that's my presentation.